Hello everyone, welcome to this short talk on vascular imaging. My name is Yiewfah Fong, a radiology registrar at UHL. Vascular imaging is all about imaging of blood vessels and its associated vascular pathologies. The aim of this talk is to provide you with a brief, broad overview of the different imaging modalities used in vascular imaging and also a basic understanding of the technologies behind them. We will be looking at some examples in this talk, and I have to give a shout out to radiopedia.org as all the images we see here today are taken from that website. It is a fantastic online resources for radiologists like myself and also budding future radiologists. If you're interested, go check it out. So let's kick off. What imaging modalities do you know of? In general, we use plain radiograph, ultrasound, CT, MRI, and nuclear medicine in our daily work. In terms of vascular imaging, we mainly use ultrasound, CT, MRI, and angiogram. We will review each of them one at a time. Let's begin with ultrasound. As the name implies, this uses high-frequency sound to penetrate the body. A handheld probe is placed on the patient's body. Sound wave is generated and received by the probe, and then transferred to a computer to be displayed as an image in real time. Think of the probe as a fancy microphone listening to sound, and the computer then works out what it means and displays the information as an image, or in real time. Because it is real time, the images can be displayed either static or dynamic, and functional information such as direction and speed of blood flow can be measured. No radiation or contrast is used. It is readily available, relatively cheap, and very good for superficial structures such as neck and limb vessels. One drawback is that it is very user-dependent. Let's look at an example of an ultrasound image. This is an abdominal aortic aneurysm picked up on a screening ultrasound. This image on the left here is the aneurysm display lengthways, and the image on the right is an image of the aneurysm in cross-sectional. Ultrasound is the screening tool of choice for an abdominal aortic aneurysm. It tells you whether a patient has an aneurysm or not. The next image is of a carotid artery. You can make out the wall of the artery here and here, and at the bulb of the carotid artery there is a calcified plaque right here. Next, we will measure blood flow at the normal section of the artery, shown here in orange. Then we compare that to an area we saw earlier, and we can tell the velocity of the blood flow has increased with the color green and blue round here. That means there is a significant stenosis just before that. Ultrasound is also used in the diagnosis of deep vein thrombosis. On the left here, we see a pretty unremarkable image of a popliteal vein. Until we perform a compression test, pressing on the vein, and as the image demonstrated here on the right, the normal vein would collapse, but in this case, there is thrombus within the vein which prevents it from collapsing. Therefore, we have a diagnosis of a deep vein thrombosis. Now, this is really the forte of ultrasound scan, production of a video image. This video demonstrates pulsatile venous flow because of an abnormal connection between the artery and the vein right here. Another classical image of an ultrasound is that of a pseudoaneurysm. There is a damaged bit of arterial wall here. Blood is swirling out into this aneurysm, thus producing this yin-yang sign. We have seen some examples of ultrasound scan. To recap, ultrasound is widely used in vascular imaging. It is real-time, no radiation or contrast is needed, and is very good for superficial structures. The next modality I want to talk about is CT. I am sure most of you would have heard about CT. It is actually an abbreviation for computed tomography. Patients go through a machine that looks like a giant polymint, where multiple X-ray images are taken 360 degrees around the patient. The computer will take this information and display it as an image that we can interpret. The major downside of CT is radiation and the need to use contrast. But it is available around the clock, quick to perform, provides high-resolution images and detail, and the images can be manipulated and reconstructed to help with image interpretation. The first examples I want to show you is an image of a peripheral angiogram. These are images that we are familiar with when we think of CT scan. We also think about a radiologist endlessly scrolling through hundreds of images like this, and then typing up a report. How boring. With advancing computing power, we can do something more exciting, like this, displaying the exact same examination in 3D, removing all the soft tissue, and displaying the vessels and bones as seen here. And this image demonstrates completely occluded bilateral superficial femoral artery. There should be white lines connecting these two, but they are gone. Next, let's have a look at the CT scan of an abdominal aortic aneurysm. Remember we saw an ultrasound image of the same? And let's compare the two. Obviously, CT provides a much higher level of detail. Therefore, ultrasound is good as a screening tool to detect if someone has an aneurysm. If we need to proceed to repair, we will need a CT scan because we need all the anatomical information down to the millimeters. And of course, we can do the same with 3D reconstruction and display the aneurysm in its entirety, seen here. As we mentioned, CT is quick and readily available. It is the modality of choice when we suspect a vascular emergency. Here we have an emergency. The inner lining of the aorta has been stripped off, and this needs urgent surgical review and repair if required. CT is also used in trauma setting. This patient was involved in a road traffic accident. He has a large retroperitoneal hematoma seen here. It is pushing the kidney away. And if we follow the renal arteries here, we can see there is a damage and there is active blood hemorrhaging into the hematoma. This is a CT image of a pseudoaneurysm. I remember we saw an image of an ultrasound of an pseudoaneurysm before, like so. And they correlate very well with each other. It just demonstrates that the same pathology can be detected with different modalities. So to recap, we know CT is quick, readily available, provides high resolution and detailed images, and is good for most vascular pathologies. But the main downside is radiation and the use of contrast. If only we have something that will remove radiation and contrast use. Which brings me to the next modality, MRI. It stands for magnetic resonance imaging. MRI uses strong magnetic field to manipulate spinning electrons within the body. In doing so, the body in turn emits radio wave that is picked up by the MRI machine. The physics is really too complex to be covered in this talk. Nonetheless, think of the images produced look similar to CT images, but without using radiation, and in majority of the cases, no contrast is required. Unfortunately, nothing is perfect. MRI scan takes longer, therefore susceptible to movement artifact. Instead of a polo mint like in a CT machine, MRI machine resembles a big tunnel, and this can cause issues with patients that suffers with claustrophobia. It is not as readily available as CT, and there are some major contraindications such as metal implants and pacemaker. Nonetheless, MRI is sometimes preferred, for example, when patient is allergic to iodine. This is an MRI image demonstrating narrowing of the iliac arteries on the left here. And this is an MRI image of a peripheral angiogram. If we compare it side by side to a CT peripheral angiogram, the level of detail and resolution is comparable. It just means the decision whether to request a CT or an MRI takes into account of how urgently do you need the imaging, what are the contraindications, can the patient tolerate the scans. All things being equal, I would prefer MRI scan because there's no radiation or contrast involved. But if you need an imaging urgently, CT would be the choice. In some investigations, for example, for AV malformation or venous pathologies, MRI is preferred for the same reason as discussed before. This is an image of a carotid artery demonstrating occluded right internal carotid. Here you can see the artery just stops at this point. So MRI can produce resolution and detail as good as CT scans, but it's not always available. It takes longer, and there are some major contraindications for its use. It is therefore more suited to elective cases. And finally, let's talk about diagnostic angiogram. It has traditionally been seen as the gold standard for vascular imaging because the resolution is even higher than that of CT. It involves direct injection of contrast into a vessel and taking real-time images. It is, of course, invasive. Contrast and radiation dose can at times be even higher than that of a CT scan. It takes planning, it takes arranging for a theater space for this to be performed. The main strength of angiogram nowadays really is that it is both a diagnostic tool and an interventional tool. You can find out what the problem is and treat it at the same time. Remember the carotid ultrasound we saw way back at the beginning of this talk? A direct angiogram image will look like this. This is a digital subtraction image where the computer is able to remove the bones and soft tissues from the angiographic image using a reference image taken before the contrast was injected. talking about intervention, on the left here is an angiographic image of a bleed from a hepatic artery due to pancreatitis. The image on the right here shows coils being deployed, blocking off the bleeding vessels, and we have successfully treated a bleed deep within the patient's abdomen without needing open surgery. Besides blocking of vessels that is bleeding, we can open up narrow arteries with angioplasty balloon. The image on the left here demonstrates diseased arteries of the anterior tibial artery. The image in the middle shows an angioplasty balloon being inflated and it stretches out the artery. And the final result is shown here on the right, where the flow of contrast is much improved compared to the original image. Same concept is being shown here. Instead of a balloon, we now use a stent to open up a segment of the narrow iliac artery. Finally, do you remember the very first image that we looked at of the aortic aneurysm? Then we looked at the CT of the aortic aneurysm. Now we can look at ways of treating it by means of an endovascular aneurysm repair, or EVA for short. These are EVA stent grafts composed of metal scaffolding and lined with graft material. They are constrained into small tubes that we can deliver into the aorta, and once deployed, they will expand to their initial shape and held in place within the aorta to exclude blood flow to the aneurysm sac. In this image, we can see there is a large bulge on the side of the aorta. And here we can see the stent graft being deployed within the aorta, successfully occluding blood flow into the sac we saw earlier. EVA has really transformed aneurysm treatment because it is less invasive and patient recovers much quicker after the procedure. So even though angiogram is invasive, uses contrast and radiation, it is traditionally considered to be the gold standard for vascular imaging. Its strength nowadays lies with its intervention ability. A lot of emergency and elective cases can be successfully treated with endovascular technique. We have gone through a quick and broad review of vascular imaging. As a summary, ultrasound involves no radiation or contrast use. It is relatively cheap and is considered in most circumstances to be the first-line investigation. CT and MRI produces detailed images. However, CT is quicker, but involves radiation and contrast use. This is the choice when imaging is needed urgently. Whereas MRI is slower, there are more constraints on its use due to contraindication, but it does not have radiation or the need for contrast. Finally, interventional radiology is growing in its use and is able to treat a wide range of vascular pathologies without the need for open surgery. Well, thank you very much for your time. I hope you have gained some insight into the world of vascular imaging. My name is Yiewfah Fong. Radiology Registrar at UHL. Thank you.